Okay, we're ready when you are.
Can you hear me now?
Yes.
Okay. Did you do roll call?
Amobian,
Present.
Freeman,
Here.
Baylor,
Here.
Neal,
Here.
Lombardo.
Here.
All committee members are present.
Thank you very much. May I have a motion from someone to suspend all council rules that require or contemplate in-person meetings and in-person voting?
I'll make that motion.
It's been moved
Second.
and- It's been moved and seconded. All in favor?
Aye.
Aye.
Okay. Are there any minutes from our previous meeting, Ms. Sarah?
Yes.
May I have a motion to accept the minutes from the previous meeting?
So moved.
So move.
It's been moved and seconded. All in favor?
Aye.
Okay. So the minutes have been approved. We have one piece of legislation. It's an ordinance ordering that all persons in public places within the city of Akron wear a face covering to limit the spread of COVID-19 and declaring an emergency. I understand we have several individuals here, and I will turn it over to, is the health commissioner speaking first, Sarah? Sarah?
I'm sorry, I don't know the order of who
Okay,
wanted to go first.
who's going first?
Well, it doesn't matter. I know Donna has a lot of the technical information of which many of you are aware of. First, thank all of you for the jobs over the ensuing months. I even think back into March when we started to talk about stopping the spread, that this was kind of up there with some of the mayors that across the state of what we were talking about, but it never really got, a whole lot of traction, with numbers where they were specifically in different counties being a little bit different. And then as the reopening has gone, continue to try to talk about this and hopefully not trying to get to this particular point. But in talking to ODH and in talking to Donna about why this was needed, when you start to see some of the numbers in and around, not just Akron, but Summit County, the entire goal was to not go from, purple's the worst, then red, then orange, then yellow. And I know all of you are familiar with the coding, but trying not to get to red. But we had sometime last week or mid last week, got to right in that first category of red. There's 8 different categories. What if you hit, and for example, Columbus has got 7 out of 8 of them. And we're actually at 4, which is that beginning category of red. And hopefully we don't get to 5, but stopping that spread has been key. And a mask is the most effective way to be able to do that. And so we've been talking about different ways to do it. And here is where we are to do that, to stop that spread. And so it's a pretty thoughtful consideration of how to do that in and around public, with public health, doing the enforcement side, but also mandating inside and outside of public where you're supposed to wear a mask, but taking into consideration all the exceptions when it comes to, children, certain OSHA rules, a lot of different things, maintaining 6 feet of distance, not having to do it with your run. And I know Don will have a lot more of that, but I appreciate the consideration. I know it can work. I think it has worked. And so I would appreciate your support and passage. Thank you.
So Donna, the commissioner, are you available?
Yes, I am. Can you hear me?
Sure.
Yeah.
very
Okay,
well.
great. I wasn't sure if I had unmuted. My name is Donna Scota, Health Commissioner, Summit County Public Health. Thank you for the opportunity to present. I really want to emphasize what the mayor has just indicated. We did send a fairly confusing message early on when CDC had said that they really felt as though masking was effective, but we didn't need to do it as a group. And that was because they were so worried about PPE, and they were really afraid that there was going to be even more of a shortage of PPE. They have since revised that guidance to say that yes, masking is important, and it doesn't have to be a medical grade mask. It could be a cloth covering that does help protect the other person from the wearer. So what you have to remember is the masking really is for the people around you because it stops the spread of the air droplets. So everyone wearing a mask in an area, if you're closer than 6 feet, prevents the spread of COVID-19 because most of this is spread via air droplets. And because of that confusion at first, I think people have really said, well, you know, I don't know necessarily if it's going to make a big difference. It does make a huge difference. Social distancing, wearing a mask, has been proven to cut about 80% of the transmission. And I think you may have heard me say this before, when COVID came along, the flu died off. We never saw that second burst of flu. Usually we see a peak, we never saw it. So I just want to say that when we did some just generalized community testing without symptoms, our positivity rate was about 4.58%. You would expect about 2 to 3% when you know there's a virus circulating. Some of these communities that are really having difficulties now, Florida, Arizona, Texas, their rates are up in the 20s, 25% positivity. That means that 1 in 4, 1 in 5 are getting really sick. The problem is you cannot predict who is an asymptomatic carrier. You cannot predict who will get sick out of this and how badly they will get sick. So I just want to sort of reiterate, our numbers are up. We know that masking works. Since we have gone to red, we now have mandated masks per state order. However, we won't probably stay red forever. And hopefully when we would go back to orange and yellow, we would want to still have masking in place to avoid getting to the next level, meaning going back to red. But I think there's some confusion around, some individuals think that public health could just pass an order and everything would be good. Let me explain to you like our options here, which are the good, better, and best. Good is us passing a general code for the community. We have the authority, but it's not that great. Health departments can regulate public health and communicable disease, but that's not something we've been ever given specific authority in revised code to do. Better option would be the state issuing a masking order, which is in place for red designation. The director of health has the authority to make special orders to prevent the spread of contagions or infectious disease. And their authority supersedes ours as a health department locally. The best option for us is a city by city approach. This is because cities have very clear constitutional authority to regulate public health, safety, general welfare, and morals. Since they have that broad authority, any challenge to this ordinance is very much likely to fail. So we feel as though we're on much better legal ground going jurisdiction by jurisdiction and trying to get this in place. So then when we do leave the red designation, we still have in place a masking order. But I want to add one more thing because I often hear this from individuals who are opposed to masking. They make reference to when the first SARS-CoV came through. Well, the first SARS-CoV-1 was a very different virus. Basically what it did, it was all the cases in the United States were related to travel. It lasted about 8 months or 5 months. and it went away with about 8,000 cases. It just disappeared, literally. But that's because it's a different virus. And how it replicates in your lower lungs, meaning when it's way deep in your lungs, it's far harder to cough it out, spit, sneeze, singing. It's harder to get that out. This SARS-CoV-2, which we now call COVID-19, is replicating in the upper respiratory system, meaning it's in your nasal, it's in your chest, it's high up. So when you cough or you spit or you sing or talk loudly or just normal breathing with respiration, it is really what is causing this to be so contagious. So even if we drop back, there's two reasons. I mean, there's lots of reasons, but two really main reasons that we should all really rally together and wear a mask whenever we can is to, number one, get our kids back in school and keep our kids in school, because children deserve an education with an educator professional, and they deserve to have that opportunity. And if we can't keep them safe, they're going to have a hard time keeping them in there. And the second thing is we want to keep our businesses open, because those same families, that's how people feed their families. We need to keep our economy running. We need to learn to deal with a virus that is circulating in the earth, in the earth everywhere. I mean, literally the world. And we need to make sure that we can protect our residents in Summit County. And this is a start, because you guys were so far ahead of it on the T21. And I think I have told many of you, your numbers in Akron looked better on T21 than anyone's. And when on the youth survey, it's because you were ahead of it. And when you outlaw something and regulate it, people do a better job at conforming. So I want to thank you for that. And I thank you for considering this. And I'm glad to ask or answer any questions you might have.
Okay, before we get to that, Councilwoman Samples, are you on?
I am. I'm here.
Would you like to make a comment?
Yes, just very briefly. I think that we are to a point here in our city that something had to be done to protect the residents of Akron, even outside of the mandate from the governor, to make sure that we are doing our part to keep our residents safe, and for us to really just take a look at the disparity in percentages as to how COVID-19 is affecting the African-American community and the poly community. There seems to be a surge within those communities. And just for us being in the orange and going to the red was alarming enough, but to see that our neighboring community, Collier County, has a star potentially going to purple is even more concerning, because as you know, a lot of people commute to Collier County for work, and then they're coming back into Summit County. So, you know, we have people who are going into an area that may turn purple, coming into our area where we're trying to control it. So just I want to thank Donna Skoda for all that she's been doing as it relates to this, and just being very accessible during this. And Mayor Horrigan, thank you. I know you probably got tired of my text messages, but I think that we all are on the same page, and we want to make sure that we keep Akron residents safe and COVID-free as much as we possibly can. Thank you.
Thank you very much. I totally agree with everything that's been said. I know the three things that I have heard people emphasize, and I continue to emphasize: washing hands frequently, wearing a mask, and keeping that safe distance. The one piece about the legislation that I wish someone could address is, how do you plan to enforce it? And I know that the paper talked about some fines and the legislation talks about fines. So I know that the first order of business is to make sure that we educate people and encourage them to keep themselves and others safe and try to keep this virus from spreading. And then I know that sometimes when you enforce things, that you have to have some type of punitive way of addressing it. providing people are not adhering to the warning. So could someone talk about that piece, please? Donna Scotta,
Yeah,
could
yeah,
you?
Linda, I'm here. I can certainly address it. I didn't know if Ellen or the mayor wanted to talk about what's in there, but no, let me just tell you our approach, Ellen. This certainly sounds very much, it is very reminiscent of Smoke Free Ohio. And our whole entire approach with Smoke Free Ohio was trying to get people to be compliant. It isn't to hit people with a lot of fines or be out and being very disrespectful. It is really educationally based. And we want individuals to comply because the end result we want is not to collect a bunch of $50 fines, but rather to have individuals compliant, because then we know we have a chance at fighting the disease. And we know that wins. That money doesn't save lives. We could collect $50 until the cows come home. It will not change the outcome if we do not get people to change behaviors. And the literature is clear that, in fact, if you go in there, there's the penalty to the business, there's a civil penalty, but that's only after a series of warnings. And I have to tell you, in Smoke Free Ohio, probably the first 2 to 3 months, we had a lot of complaints. We go out, educate folks, tell them do something simple, take the ashtrays away. We'll have signs, printed up, where you put your signs, masking required, having people sit distantly, helping the businesses and the bars be successful. That look at the whole idea of help us stay open, stay 6 feet away from us. So we've done all sorts of things to help those businesses. So in reality, it will be educationally based. Fines and any sort of civil penalty, any sort of criminal at a very, very end stage. You got to do a lot to get to that point. And really, we would be working with the businesses to help them be successful, as well as individuals. And sometimes when you just talk to somebody and explain to them what they're doing, I'm not going to lie and tell you we have 100% compliance. We won't get it. There's that 10% out there that still argue with me every day that it's a hoax and we did it. We caused this so that I don't know what. I've heard everything from you name it. So, but there's that 10% fine. But if we can get to that 80 to 90%, we're golden, because then we know we will reduce the spread of disease. And I have to tell you, my experience in Akron and all of the villages, cities, townships, the individuals in Akron are unique. We have had very few problems. They are very kind-hearted. They want to do the right thing. And I have said this before, and I will go to my grave saying this. People want the same things. We just have to give them a way to get it. And so I think working with everyone will get there. We have had overwhelmingly more contacts with the health department in favor of masking. People have said, thank you, I appreciate it, it's about time, as compared to individuals who it's a conspiracy and we're all going to hell. So just so you know, I think we're all in a good place right now with this, and it is the right thing to do. Linda, you summed it up. Wash your hands, stay away, and wear a mask.
Yeah, and the other thing that I agree with you, that most of the emails I've seen have been more positive and people encouraging us to pass this. Could someone talk about those individuals who want to wear a mask, who may not be able to either afford or find one? Because I know at my place of work, we have people donating masks all the time. I would imagine there are places in the city where people are sending masks.
Yeah,
and
I can address that. I'm sorry. We're working on a large supply that we've gotten donated from a fairly large company in Ohio that is doing it to a lot of the major cities. I should have some more information by the end of the week. And really, it's a face covering. And I would even add to what Donna was saying. Public health has been so involved in all of this since the beginning of May when we started to reopen. It's really a natural transition to kind of for them to be involved here. At the very first part when the economy started to reopen, they got probably a larger number of complaints. Now they've trickled off, and I think that's what you'll see with this too. But we hope to have a supply of masks. Now it's not an unending supply. and they're just the normal blue ones. They're not surgical grade or anything, but it's a face covering. So I hope to have some more that would be able to pass out, or at least help a business at transition for a month or maybe a couple of weeks, something like that. We'll have those obviously for some employees and maybe even at our substations like the water department facilities, which nobody goes in there anyway, but especially like the golf courses where we've been passing them out for the weekend too. If you go into the golf course, you need to use the restroom or you got to wash your hands, you got to wear a mask going in, and then you take it off when you go back out and golf. So we should have some. And I know a lot of people have made them. And I think this will even pick up more with that part of it too. So there should be plenty out there. But if really somebody is in a pinch where they just don't have any, let us know. We're more than happy to drop off a small box of them.
And say for us, if you need anything, you're supposed to put your request through like the EMA protocol. You're supposed to go to your city, village, township, wherever you're at. But if you're in the pinch and you need masks for an event, or you just want to have them to hand out, like certainly in your place of employment, if you want us to drop off some, we'll be glad to drop some off. Just let us know. We've been actually keeping all of the non-medical grade stuff just for this, because these are the KN95s, the surgical ear loops, the things that aren't really medical grade. We make sure the hospitals, the EMS, nursing homes get the medical grade. But everything else that's not, we've been sort of hanging on to so that we can get it to individuals who need them.
Very good. Did I see your hand, Councilwoman Samples?
Yes, just briefly. Also with the masks, there's been a lot of individuals who've been sewing masks. They've been donating them. So what I've done at my house, I've created a tree, a mask tree, where we hang the mask on the trees in Ziploc bags by clothespins, and people have been coming by grabbing masks off the trees. We probably already went through close to 100 in the last 2 days. So people do want them. And I think one of the things that Rebecca and I talked about extensively in this legislation is people seem to think the city wants to get rich off of $50 for fining people, which is the most preposterous thing ever. So one of the things that we talked extensively about, and even with John York, was making sure that that money goes into a fund to purchase masks for those who can't afford them. So there's masks everywhere, and a lot of people giving away free ones. Greta Johnson gave me close to 75 masks to hang on a tree. So there's people out there that are willing to give those masks to people who need them. So, and outside of the city and the county, I think that we'll be okay with the masks if that's the excuse that they're going to use. We've got numbers all over social media they can call to get a mask if they really need one.
Good. Are there other individuals wanting to address Councilwoman Connor?
Just to piggyback on that a little bit, in our neighborhood, they've been putting them in all the little free libraries too, so that the neighbors and especially the children have access to them.
Very good. Are there other council persons?
What's the measure for time? How do we determine, when this ends?
I've been thinking about that also, and we've always been guided by the best public health knowledge, but this gives us the flexibility to be able to continue to do it even if the county goes back out of. I honestly believe that obviously COVID will not be here forever, and they will develop a vaccine and we'll be able to get it out. I don't want to just say, and this is from a personal perspective, I don't want to just say, just since we moved to orange, it's okay not to wear a mask again. Maybe that's the new normal for the rest of the year. You know what I mean? I'm certainly willing to have that conversation, but it's not defined in there when it comes out. But listen, if cases go to 0 next week because the heat worked, well, that's a whole different story. It's really hard to pinpoint a date. And I wish I could say, listen, December, but I would rather get used to it for now and then not have to do it when it's really okay. And that's been I don't have a great answer. I don't. I mean, I'm trying to pinpoint it as close as I can, but I'd rather be safe than not. And so that's where I am.
And this prompted me to go out and look at Ohio Revised Code. It looks like, and correct me if I'm wrong, it looks like something like this gives the local, which I'm assuming would be the county, that it actually gives them policing powers. That's what Ohio Revised Code looks like.
I think what you're talking about, Councilman Freeman, is that in the time of disease, communicable disease, we do have the power to deputize and be able to police. That isn't our interest, though. Our interest is really getting compliance. And I'm a big believer in you win more flies with honey than vinegar. And you want people to think like you do. And we've been very successful in the past helping businesses be successful. And we have very few that have ever not cooperated. They might not have liked it, but they understood at the end what they were doing. And so I think your point is well taken. We just never, ever had to go that far.
Yeah. I've wore masks since day one. I have a wife with a compromised immune system, have faithfully worn a mask, but I'm kind of getting stuck on this one. And I think by law, we have the power by law to tell folks you have to wear a mask. I'm just stuck on, government saying you got to wear a mask. But Donna, understand the place I came from. I'm glad I go to a restaurant and nobody's smoking, but I personally thought it was an atrocity that we could take somebody that put their hard-earned money into a restaurant and then could say to them, no one can ever smoke. My thinking was decision was made at the door by somebody that comes in. So, and I'm a mask fan. I get aggravated when I go to Home Depot and they don't have masks on. I am struggling though with, a government order for wearing masks, but at the same time, I'm going to have mine on when I get out of the car here in 20 minutes.
Okay. Councilman Lombardo and then Councilman Malik.
Thank you. Thank you. In regards to the legislation where the section talks about those persons that the face mask would not apply to because of a medical condition or any other type of disability. When these people are out in public, is there any way so they don't feel shamed as far as like someone looking at them because they're not complying? Is there any way that maybe they could wear a wristband or something on their lapel to say that, hey, we have a medical condition and it's not required for us to wear a face mask?
We've been asked that question a couple times. It depends on who you are as to what you think. Some have felt that's targeting in your identifying individuals and labeling them with some disability. For any kind of, emotional support dog, seeing eye, any sort of support animal, you're not allowed to actually ask why they're having that animal. It is their private reason. So we have sort of taken the approach, if they tell us, and I think that's part of the messaging that we need to realize there is a group of people that cannot wear a mask. If they can't breathe well, they may have some compromised lung function, they may have claustrophobia. Children with autism typically are tactile defensive. They don't like things on their faces. So, I think we just the messaging has to be respect and asking individuals, to not single out people. I've not ever seen that. But then again, I don't look for it that way. When I see someone without a mask, I assume they have a reason for not wearing it. I guess we could offer a wristband if people wanted it, but I wouldn't want to mandate that or ask that you have to have a wristband, because people have private situations that I don't want them to have to share their medical information.
And I would even say there are going to be people that take advantage of this too. And with this many people in and around the community, some people will walk in and say, I'm not wearing them and I have a condition. I'm not showing you a piece of paper. Like Donna said, I think, the 100% compliance is a pie in the sky. If we can get to that 80 and above, which I don't think we're that far off when it comes to
I don't
that.
either.
I think we're not far off, but it's relative and it's anecdotal. It's not complete. Looking to corral all of that. And Mike, I think to your point too, this is temporary. It's not going to be permanent where we're going to make you wear a mask forever. It's just seeing where those things go and then backing off at the right public health time is I think is a prudent move to be able to stop that spread. So,
Councilman Malik.
Thank you. Yes, I just wanted to, speak in favor of the legislation as well and say that, we have all been trying to deal with this as best we can in such an uncertain environment since the beginning of this crisis. And I know we've seen, the mayor has encouraged, every single time I've seen him encourage wearing masks, and everyone on this call has. And I think with such a strange response at the federal, state, and local level, it's created so much further uncertainty about what we're supposed to do and what we're asking them to do. And we look at the difference between how the case numbers are in Europe and other places versus the US. And we've seen that we have to take a more serious approach to this to really get it under control. And I totally agree with what, most people are law-abiding, decent people who will do what is asked of them. And if we're saying, look, this is for the sake of the employees in that restaurant who don't have a choice whether to come to work or not, but they really, need to be protected from the folks who are sitting in that restaurant consuming the food or what have you in other stores, we have to make sure that those people are protected. And so, I appreciate everyone coming together to put this together. I appreciate the sort of light touch enforcement and the ability to have masks be available. And I really I'm glad that we're doing this.
Thank you very much, Mrs. Horsky.
Yeah, I also strongly support this ordinance. And I think Mr. Malik just ended with a good note about the cooperation that went into the ordinance with Mrs. Samples and the mayor and the other co-sponsors. We appreciate that we are able to find some common ground and to come up with something that we can enforce and that we can use to get some compliance, but without going too far in that direction of enforcement. Yes, there are individual rights involved in this situation. And Mr. Freeman, I hope that you consider not only the rights of the people who don't want to wear a mask, but the rights of the people, as we did in the secondhand smoke issue, to go into a restaurant, or children to go into a restaurant and not be exposed to secondhand smoke. Children's bodies being more vulnerable. In this case, the virus is also an individual rights case to go to a restaurant, not being exposed to a virus, to go to work, not be exposed to a virus. The individual's right is at stake here, but it also is not just the people who don't want to wear masks for, in my opinion, some sort of ideological reason. The individual has a right to a safe and healthy environment, whether it be on a playground, whether it be in an apartment building. If you think about the number of Akron residents who are living in multi-unit housing developments, and that's an area where I think our ordinance is a little stronger than even what's happening statewide. Is that correct, Mrs. Nish? Compared to the existing order, we include multi-unit housing. I think that's an advantage. I think we're protecting individual rights. And overall, though, it all comes down to this: a bigger principle than any law that the city government could pass, and that is called love thy neighbor. Let's put that first.
Thank you very much. Are there any other individuals? I can't see all the hands. I don't know if you see any more, Sarah, or not.
I can see Councilman Neal and Councilwoman Baylor's hands are both up.
Okay, can you please, Councilman Neal, then Baylor?
Okay, thank you. I appreciate the conversation I was been able to hear. I think part of this reminds me of a lot of concern we had when we brought legislation in regarding people driving in their cars with cell phones, and we thought it would be adversely impact a segment of our community. The one place that we talk about when we talk about restaurants, this legislation really doesn't cover it, because if you're drinking or if you're eating, and what do you do in a restaurant, but you drink or you eat, you're not going to have a mask on. I think what it does do for people, though, and I can say from a business in my ward, a lot of people were calling with concern about the Save-A-Lot in my ward and saying, hey, they're not enforcing people to have on masks, where their employees had on masks and they had this safety protected glass. But at that time, they were following what the state was doing. Since, of course, there's been this change, now they, like other stores, I know, have a security guard, and when you come to to the front door, they can now say you need to wear a mask. So I think this helps in stores, much like no shirt, no shoes, no mask, they won't be serviced. My concern is, on the street aspect, I'm just hoping we don't get anyone trying to use this as a bully club on folks. But I know it will help businesses. But I think from a standpoint as a city, we need to even change our whole focus and have everybody act like they have the disease. Everyone needs to act like they have the disease. 2 weeks ago, now I went like I believe the mayor went, some others went to the house of the Lord, and I got my test. Well, I got the answer back. By the time I got the answer back, and it doesn't matter if I got it back in 24 hours, I got mine back in about 4 or 5 days, that test didn't mean anything because I could have contacted something in between. So all of us need to act like we have the disease, use the social distancing, whatnot. And then our focus as a city, I spoke with a former school board member, a strong community advocate, Sheila Smith, who shared with me she had a friend or a family member, I can't remember, who's struggling with the disease right now. And her concern was, here she had somebody in ICU, but the members of that household, one being his 92-year-old mother and some others, had not been checked. So I think we need to change our direction. And one, if anyone comes down with the disease, we need to backtrack where their immediate surrounding is and check those people, because that's a more definitive demographic that could have potentially been affected, rather than folks coming in just to get tested. This is just my opinion, because we know that population has definitely been exposed. And then educate the rest of our community to act like you have the virus. Because like I took the test, and of course, if I would have found out that I had it, that would have been a good thing. But for all of us that took that test and came up negative, guess what? It doesn't mean a thing, because today we could be positive. So I think we have to have more discussion. I know, even though I like Mr. Freeman, have some concerns. And my main concern is this. I don't want to hear mask until a vaccine. That's my concern. I don't want mandatory vaccines. But I think the mask, the beautiful thing about our country is we all have freedom. The challenge comes when my freedom imposes on yours and yours imposes on mine. So that being said, I can tell you from a business owner standpoint, businesses appreciate being able to have this legislation, because now, like the Save a Lot in my ward, they're able to enforce people coming in with masks. But I think as a city, we need to rethink this thing so that we can,
Thank you very much, Councilman Neal. After Councilwoman Baylor, Commissioner Scota, if you could just talk a little bit about once a person is identified and the tracing that goes after that, because all of the things that Councilman Neal talked about, there's a process in place that once a person is identified as having it, that the county health department has to go through. But Councilwoman Baylor.
I just want to say thanks to all those who worked on the ordinance, and I too strongly support it. Just as like the mayor and Councilman Neal had explained, Councilman Neal said he wants to act like he got the virus until there is a cure. The mayor said, just act like, there is no cure and just keep wearing a mask. I fit in that same category as far as my thoughts and concerns are, but I had looked at an article dating all the way back to 1905, where a case went before the Supreme Court, and there was a guy that lived in Massachusetts. He was arguing that he shouldn't be, this was when the smallpox was really rampant as far as a disease, that he should not be compelled to be vaccinated against the smallpox. But then at that time, the Supreme Court found in favor of the state against the man, saying that, the public welfare trumps individual liberties. And so not that that is true in this sense or anything like that, because we really should have the wherewithal and the heart to want to do things to protect our other, the other citizens out there as far as wearing a mask is concerned. I mean, if you look at it as a small sacrifice in comparison to a whole lot of things that could be going on at this time. So I just wanted to say that we have to look at the public welfare rather than just our own liberties sometimes, and not, just hold to some self-centered stance, when if we just go ahead and be compliant, that we can help others and we can help businesses and other things thrive and survive, because then they don't have to come out and say this or that, because we have an ordinance in place that says if you don't this and that, then they can't serve you. So it protects them as well. So we're all working, trying to protect each other. So I just wanted to say that. And Donna Skoda, you've just been great with the health department. You always have, with everything that has come into our county. So I thank you always for your input.
Thank you.
Donna, do you want to talk a little bit briefly about the tracing piece?
Correct. Contact tracing it's interesting in this virus. Contact tracing has been going on for years in public health. It goes on quietly and discreetly, and very respectful of individuals. And so contact tracing is done with the utmost of confidentiality, in that when a index case is identified, we then go backwards, and depending on the algorithm and the guidance we get from CDC, we talk about those individuals within the last 48 hours, 72 hours, depending on your situation. This is very important in trying to control a disease, because what you basically do then, as Russ has indicated, you identify individuals that have been with this person close enough for 15 minutes. Now, even if you have a cloth face covering on, you will still be considered a contact. I want you to know that, because it's the utmost of precaution. You're not using medical grade protection. It helps. It's not a cure-all and end-all, okay? So what we have here is when we trace back, we identify those individuals. They're immediately, if they're showing no symptoms, are sent a quarantine letter. If they're sick, they get an isolation letter. And basically what it says is you have to stay home 14 days. And then we call those people every day and talk to them to make sure they're okay. We try to find them every day. I should say we're not always successful at connecting with everyone every day, but we do try to talk to their contacts to make sure. Now, what we have found in the middle of this about, I want to say 7 weeks ago, the state switched systems on us. So we had to leave REDCap, and we now have to go what's called OCTS, which is the Ohio Contact Tracing System. So we had to go to a new system. Out of the individual contacts that we have had since then, I want to say it's been right around 2,000 contacts in there since we switched systems. Out of that, we had about 13% of those contacts that went on to be cases. That's why it's important to continually try to track down where people have been and who they have been with. There is in the governor's order the mandate to notify employers, and employers have to notify us. So we have on our website a link under our COVID that just says report a positive employee. And all that does is when you check on that and you report that you've had a positive employee, that then, first of all, you get an email with all kinds of information in it. But second of all, it allows us to track and make sure there's not more than one case coming from those businesses. So let's say you have a really big business like First Energy, where you have a lot of employees, or the city of Akron that has a lot of departments. Somebody in one department might report a person positive, but not know about the 3 other people that were positive around the corner or down the hall or in a different department. So by requiring that all people report, it allows us to identify if in fact we might have an outbreak on our hands. Anytime you get 2 or more cases, we have to assign what's known as an outbreak number, and then that's a number by which we track all cases. That's how we can keep track and link cases together. That's how we know that 13% of those cases, those contacts that we talked to, converted to actual cases because we link their numbers with a database. And that way we can keep track of who's been with who and where they've been and who gets sick. So it's a very old sort of concept of contact tracing. It's just really come to light more with this COVID-19 because it has come to be very important. That's one of the things we're seeing now. For a while there, when we were contact tracing, we didn't have very many contacts because nobody was going anywhere because we were shut down. Well, now people are going places again, so we have more contacts. So it does make it, particularly among youngsters. And when I say youngsters, I'm talking about people under 30, 40 years of age that are out a lot more than, let's say, I would be out. And so when they're out more in restaurants or going places, they have a more of a potential to catch COVID-19. It's extremely contagious.
Thank you very much. I think we've had a lot of good discussion. I'd like to have a motion to accept the ordinance with suspension of the rules, please.
Councilwoman, I'm not sure if you can see Councilman Swirsky's hand is up.
I just had one more question.
Go ahead.
Can you give us a little more about the education efforts that are underway? Will we be working closely with the businesses? Are we producing materials that can be posted on Facebook, that could be shared in other ways? How are we going to be supporting the businesses and agencies and apartment buildings that need to educate the people that they're involved with?
I can tell you from where I sit, CDC has provided a lot of excellent materials that people are downloading and copying and laminating and placing it all over the place. And a lot of the organizations and businesses that I've been into, you will see a lot of the CDC materials. I don't know if you have any more than that to add, Donna, or not, but I know this.
The only thing is we are giving out, we're just in the process of printing additional signs. We have had some signage. We make sure that it's available to individuals. We work with any of the senior congregate living. We've been getting some information to them as well. We've actually started doing some testing. Last Friday, we did testing today, and we're doing testing tomorrow in some of the senior congregate living. And so we're trying to make sure we work a lot with the chamber, and we have the Employers for Health Consortium website, which is free and open to people, where we post every single COVID-19 resource. And then again, Rich, if people call us and specifically want guidance, we send out guidance all day long. And then we synthesize and analyze the governor's orders, and we try to abstract it to make it more readable, because some of it's just too long and people don't have that kind of time. So we do hand out abstracted guidance as well.
Thank you very much. May I have a motion to?
Councilwoman.
Yes.
I'm so sorry to interrupt. I'm not sure if you can see that Ellen Landernish's hand's up.
No, I can't see it. Go ahead. I'm sorry. My screen only has 9 places on it. Go ahead.
Thank you, Chairwoman. I'm sorry.
Sir.
I won't take much longer here, but I wanted to add to what Commissioner Skoda said about education. In the mayor's office, we've been developing a very thorough frequently asked questions document that we tried to encompass all the questions we've gotten over the last week. And that resource will be available on our website. We will make that available to all of you council members, any business who has any questions about when masks are required, when they're not, the exemptions, that sort of information. Also, we will send out information about how to report a violation. There's a portal on Summit County Public Health's website, and there's a phone number that people can call. APD will have that information. I just wanted to also clarify, because that came up a couple times in the conversation, that the Akron Police Department will not have a role in enforcing this order. No criminal charges will be filed. No one will be pulled over or stopped by the police for not wearing a mask. It will all be handled by public health. If individuals call 911 to make a report, they'll be directed to public health. And again, those will be after the fact follow-up visits that Donna talked about, where they do education and talk about their policies and their procedures. So there's no criminal aspect to this order at all. And that's one of the benefits of having Akron City Council pass their own local ordinance, because under the state order, the only penalty is a misdemeanor. So this allows Akron officials to use a civil penalty through public health as opposed to going down a criminal pathway. Also, what was talked about earlier is the length of the order. So just to make it clear, that order will stay in place until this council repeals it. So that will mean bringing Donna back, bringing those professional advice back to talk about when it's appropriate in Akron to withdraw this face covering order and when it's no longer required. And then I just wanted to touch on a couple of things. As Councilman Swirsky said, yes, we added to the Akron ordinance that the common areas of apartment buildings and multi-unit housing is covered, because that was a concern that actually Councilman Swirsky raised, and we looked at it and felt that it was important to clarify that, so individuals who live in apartment buildings feel safe in their elevators and their stairways and their other common areas. And really, that's all. I just wanted to answer a couple of those questions. Thank you so much.
Thank you very much.
How many officers, before we vote, how many officers does the health department have that they would be at their disposal to enforce?
Councilman Freeman, we don't call them officers, they're registered sanitarians. And they're out in restaurants all day long, and we have about 30 to 40 in the field on any one given day.
Okay, thank you.
Okay, may I have a motion to suspend the rules and accept the favorable report?
I'll make that motion to suspend the rules and accept a favorable report.
Is there a second?
Second.
It's been moved and seconded. All in favor?
Aye.
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 I'll abstain.
Excuse me?
I'm abstaining.
Okay. Did you get that, Sarah?
I did. Thank you.
All members, yes, except Mr. Freeman's abstaining.
And I can see that Councilman Neal's hand is raised. I'm not sure if you can see him.
No, I can't.
Thanks.
Mr. Neal?
Yeah, thank you. I may have missed this part because I had a call that I had to take earlier in the meeting. When I heard the part about, I want to make sure the part of enforcement, I'm sure that was discussed. How are we talking about enforcement? It made me think about it when Councilman Freeman talked about how many healthcare people.
Summit County Public Health. Commissioner, you want to address that quickly, please?
Complaint-based response, just like we do for Smoke Free Ohio, just like we do for everything. So what we do is we receive a complaint via our complaint line or an after-hours phone call, and then sanitarians visit and or depending on what needs to happen. Because the governor's orders have been written differently than in the past, sometimes we do joint visits with the special task force. That was during restaurant compliance. You know, they would make sure everybody went in there and they were 6 feet apart because they have a separate guidance for dining orders. So our sanitarians are doing enforcement every day. So they're out visiting restaurants. They're making sure that they're doing everything they're supposed to do for, you know, keeping a safe and clean operating restaurant. However, they also talk about the governor's ordinance, guidance, give them signage if they want it, ask what they need. They may need masks. As you know, restaurants and bars and some businesses are in a unique situation because of the kind of work their persons do, their employees do. They may not need to wear a mask. Like there is some fire hazard to wearing a mask behind a grill. You know, it's pretty hot back there. And so we don't want individuals wearing that mask. Or if you're in a factory when it's 120 degrees, we don't want you wearing that face covering either. That might cause you to have difficulty. So they work with that business on how to meet the order of the rule and how to be successful. Because as I have said, we want businesses open. it'll be good for everybody. It's good for parents, it's good for the business, it's good for schools, it's good for everybody.
Thank you, but I just want to make sure, because when we said that this has more than a misdemeanor, that it can lead to civil penalties.
I can try to answer that. I'm sorry if I was confusing. So the state order, which is currently in place for all of Summit County, which is the order that Governor DeWine announced last week because Summit County is in a red status, the only enforcement option under that is for Summit County Public Health to pursue misdemeanor criminal charges. And the purpose of this ordinance that's before you guys today is to create a local civil penalty. So that means only a fine. There's not going to be any criminal charges. There's not going to be any court proceeding. So it's not going to be something that it gets someone involved in the court system. It's only going to be a civil fine like a parking ticket would be. And that all the enforcement will go through public health, as Commissioner Skoda just explained. So that's the key point.
I'm sorry. And before, I want to say, and before we would enforce that, we would use common sense to lead.
Yes, all warnings, education, right.
Oh, no, the reason why I say this, because there were people purposefully looking to place blame on certain businesses and blast them and give them negative press, you know, or certain locations. I just want to make sure that you know, the first line of defense is just going to be education.
Oh yeah, and Russ, we get complaints all the time when we go out. We find nothing wrong. When we go out, they're perfectly fine. Then we find out later it's just a disgruntled employee.
Yeah, well, thank you for that, because disgruntled employee, disgruntled neighbor, yeah, thank you.
Oh no, we get it all the time.
Okay.
Thank
So we've had a motion, we had a second. Did we vote?
We did, but there was an interruption. I just want to make sure I have everybody's vote recorded accurately. So I had 4-0 with 1 abstention by Freeman. Is that correct, committee members?
Yes.
Okay, thank you.
Okay, no further business coming before us. May I have a motion to adjourn?
I'll make a motion to adjourn.
All in favor of adjourning?
Aye.
We're done. Thank you very much.
Thank you.